Hello and welcome to part 1 of this endocrine revision in the crash course guide. Today we're going to be looking at the basic principles of the endocrine system and the hypothalamus and pituitary gland in depth. In later videos we will be looking at other aspects of the endocrine system, but today we're really going to focus on the hypothalamus and pituitary gland because of course this is where the endocrine system all begins. So let's start with a few questions to get your brain thinking. And as always, I'd recommend you pause the videos at these points in order to give yourself time to think, as I'm going to go through them in a timely manner in order to ensure these videos are fairly short. So question 1 is, what produces glucocorticoids? So by this I mean where are they produced? Is it the zona fasciculata, zona glomerulosa, zona reticularis, or the adrenal medulla? And in this case, you should know that an example of a glucocorticoid is cortisol, and they're produced from the zona fasciculata. We'll go over this in a little bit more detail later on. The next question is, what do T3 and T4 attach to when they travel in the blood? So is it colloid, TSH, TBG, or iodine? So here, think about T3 and T4 and where they come from. So they come from a thyroid gland, and therefore that should help you figure out the answer in the respect that actually it's thyroid binding globulin that T3 and T4 attach to in the blood. So really knowing your abbreviations there actually helps with the answer. It's easy to get confused on this question with regards to iodine and colloid because they are aspects of the thyroid synthesis of T3 and T4, but we'll go over that in a little bit more detail later. And the final question is, which cells of the pancreas produce glucagon and insulin respectively? So read the answers carefully here. And to put this into context, remember that glucagon increases the glucose in the blood and insulin decreases the glucose in the blood. In terms of endocrine cells of the pancreas, there aren't really that many. There are alpha cells which produce glucagon, beta cells which produce insulin, and then you have delta cells which secrete somatostatin. And again, we'll cover this in a later video. So first of all, let's have a look at some of the basic principles of the endocrine system. So the endocrine glands are the hypothalamus and the pituitary, which are right at the top and pretty much coordinate all of the endocrine activity in the body. You then got the pineal gland, the thyroid, the parathyroid, the adrenal glands, the pancreas, the ovaries and the testes, which are all classified as endocrine organs because they secrete hormones. Which essentially is what the endocrine system is. It's an organ that secretes hormones. So hormones travel in the blood and have a specific receptor. And there are two types of hormones. They can be peptide hormones or steroid hormones, and this determines the way that they act. So peptide hormones don't enter the cell directly. They bind to receptor proteins in the cell membrane, and upon binding cause a secondary messenger to initiate the cell's response. So an example of a secondary messenger is CAMP or cyclic AMP, which then causes adenylated cyclase to be released. Peptide hormones are water soluble and often produce fast responses. On the other hand, steroid hormones enter through the cell membrane and bind to receptors inside the target cell. They stimulate transcription of genes directly sometimes to make certain proteins, and the response is slower than peptide hormones. So really they're comparative points between peptides and steroid hormones that are worth getting your head around. And try to know an example of each as well. So this is an overview of what we're going to be talking about with regards to the hypothalamus, the anterior pituitary, the posterior pituitary, and the hormones they release and where they go. But it's a good idea to be able to try and draw out this diagram once we've finished with the video, so you understand what's released from where and where it goes to. And if you can at the bottom, try to put the action of a certain hormone as well. So the hypothalamus, of course, is the master control centre of our endocrine centre and is located in the brain just superior to the pituitary gland, which lies in the sella turcica. So the hypothalamus, as we said, is the master. It's a small structure located inferior to the thalamus, so the thalamus is the larger part here, your hypo underneath thalamus, and then you've got your pituitary gland just slightly lower down than that. So the hypothalamus allows us to respond to external and internal stimuli whilst maintaining homeostasis. So remember, homeostasis is the balance in our bodies. And it's a central regulator, therefore, of all our autonomic and endocrine functions, such as our food intake, our body weight, our fluid and electrolyte balance, and so on. It allows us to keep everything in check. It's connected to the pituitary through the infundibulum, or the pituitary stalk, and it's connected to the brain and the limbic system as well through the various nuclei that we're going to talk about later on. So the nuclei of the hypothalamus then, in diagrammatic format, it's good to be aware of, for example, this is the ventral hypothalamus, this is the paraventricular nuclei, this is a supraoptic nuclei, and actually understanding what each of these nuclei does allows you to figure out which one is which on a diagram, particularly with regards to the nuclei that have connections to the pituitary gland. So, The arcuate nucleus, the paraventricular nucleus, the ventromedial nucleus, and the supraoptic nuclei are the ones that I think are probably most important that you get your head around, and actually probably the ones that are most related to hunger and food regulation within our bodies. So the arcuate nucleus is located at the base of the third ventricle. Some of these neurons within the arcuate nucleus contain dopamine and therefore act to inhibit the release of the hormone prolactin by the pituitary gland. Other arcuate neurons contain a substance called neuropeptide Y and therefore influence hunger, and when these neurons are activated, they can produce remarkable increases in eating, which long-term result in obesity. The paraventricular nucleus is located at the top of the third ventricle, so paraventricular and arcuate are both in the third ventricle. And the paraventricular nucleus is a group of neurons that can be activated particularly by physiological changes such as stress. Many of the neurons that are located in this nucleus actually project directly to the posterior pituitary, where they release oxytocin into the general circulation. This will become a little bit clearer later on when you understand that the posterior pituitary actually doesn't produce any hormones. It's the anterior pituitary that's synthesizing and producing its own hormones. However, the posterior pituitary actually gets its hormones from the hypothalamus and just acts as almost like a connecting station before releasing them into the general circulation. Also, paraventricular nucleus does have a role in the regulation of the appetite by releasing neuropeptide Y as well. The ventromedial nucleus, this is regarded as our satiety centre, so it's our fullness centre really, so therefore it decreases eating. And it also has several subdivisions which are involved in other roles, so this should be central. Supraoptic nucleus then, this is located at the base of the brain and it's adjacent to that optic chiasm. And as well, it's important in the production of ADH, antidiuretic hormone, or vasopressin, which again travels to the posterior pituitary and then is released into the general circulation. So it's important to know that your supraoptic nucleus and your paraventricular nucleus are the ones that are producing those hormones that are then going to pass to the posterior pituitary gland before moving to the general circulation and the target organ. So as we've said, the hypothalamus is responsible for the release of several hormones. I've put ADH and oxytocin separate at the bottom because these are the ones that are going to go to the posterior pituitary because they're actually synthesized in the hypothalamus. These hormones here are the ones that act on the anterior pituitary to cause the anterior pituitary to release a different hormone. This may seem a little confusing now, but it's good to think of it when you understand the pituitary gland as well. So the pituitary gland lies in the sella turcica, which is a bony cavity at the base of the brain, and it's connected, as we've said, to the hypothalamus by the pituitary stalk or the infundibulum. So the anterior pituitary can also be called the adenohypophysis, but the posterior pituitary can be called the neurohypophysis, and this is due to its connection with the hypothalamus and how it's connected. So the adenohypophysis is very circulatory connected, and the neurohypophysis is connected via a bundle of neurons. In terms of embryology as well, some basic points to be aware of is that the anterior pituitary comes from the Raffke pouch, and actually posterior pituitary acts as a neural outgrowth of the hypothalamus. So pituitary gland is a pea-sized structure, and it has several cell types such as lactotrophs, somatotrophs, thyrotrophs, gonadotrophs, and corticotrophs. And when you're aware of the hormones, you can actually link the cell up to each hormone and what it produces. So a little question here, what is the target tissue of luteinizing hormone? So obviously if you've done block already, you'll know that the target tissue here are the gonads, but if not, we'll learn about it in a moment. So a concept to be aware, of course, as we've said, is the anterior pituitary is connected to the hypothalamus in a vascular aspect. So the hypothalamus will release corticotropin releasing hormone, which acts on the anterior pituitary to release this hormone here, ACTH, which is adrenocorticotropic hormone. And all the other hormones act in the same way. So gonadotrophin releasing hormone causes the release of FSH and LH. Thyroid releasing hormone causes the release of thyroid stimulating hormone from the anterior pituitary. Prolactin releasing hormone releases prolactin, and then growth hormone releasing hormone releases growth hormone. So actually it's a bunch of hormones that are released from the hypothalamus acting on the anterior pituitary to release a bunch of more hormones. And this can be done from the posterior pituitary as well. However, you've just got to think this is a neural connection, and actually the ADH and oxytocin is synthesized within the hypothalamus, and the posterior pituitary just acts as a connecting station before passing out to the rest of the body. Now, it's all well and good knowing the hormones that are released from the anterior and posterior pituitary, but you also need to know what they do and where they act. So, for example, from the anterior pituitary, you have the release of ACTH, which we've already said is adrenocorticotropin hormone, and this acts on the adrenal cortex, more specifically the zona fasciculata, causing the release of cortisol. Cortisol then has many systemic effects as well. So cortisol increases fat and protein breakdown, it increases blood glucose levels, and it also has anti-inflammatory effects in the body. Next, we have TSH, so thyroid stimulating hormone, which acts upon the thyroid gland, causing release of T3 and T4. As a result, you have an increased heart rate and cardiac output. You also have an increased bone turnover and resorption, and you also have increased gut motility and lipolysis, so fat breakdown. This is really important because it all acts over several locations in the body, not just one specific place. More hormones then, so you have LH and FSH, and this is interesting because it always goes to the ovary, but in terms of what the ovaries then release is based on the stage of ovulation for the patient's at. So for example, if it releases estrogen, this indicates it's before ovulation, and this acts via a mechanism of positive feedback. And if it produces progesterone, then this is after ovulation, and it acts via a method of negative feedback. This is more to do with the urogenital system, and we'll cover this more in that video, so don't worry about not fully understanding that right now. Prolactin acts upon the mammary glands, and growth hormone is an interesting one because it acts indirectly by causing the production of IGF-1, interstitial growth factor 1 from the liver. So in children, this of course causes the linear growth, but in adults it also has an important role, so protein synthesis, carbohydrate metabolism, lipolysis and calcium homeostasis as well. So be aware that growth hormone isn't just relevant in children, it's also implicated in adults. With regards to the posterior hormones, there's only two to know about. So we have oxytocin. So this stimulates the myoepithelial contractions, in other words, in the uterus during parturition, in other words, during birth, and also in the mammary glands during lactation. So this one's really important in terms of childbearing, childbirth, and then breastfeeding afterwards. And of course you can see that via milk ejection from the lactating mammary glands as well. The other hormone produced by the posterior pituitary is the ADH or antidiuretic hormone. This can also be called vasopressin, and this acts upon the collecting ducts in the kidney, which again will be covered in the urogenital block. So in order to do this, it conserves body water and regulates tonicity of body fluids, and also it regulates, in a way, ADH is regulated by osmotic and volume stimuli. So in other words, if we are feeling really dehydrated, we want to reabsorb more water from our kidneys. In other words, we want to pass less water, and therefore the negative feedback will cause more ADH to therefore be released. Likewise, if we've drank a lot that day, we need to release a lot of that fluid, then we'll have less ADH, and therefore the collecting ducts will reabsorb less water through the aquaporins in the collecting duct, and therefore more fluid will pass as urine. So really it's all again linking back to that negative feedback we started with. So as we said here, water deprivation increases osmolarity of plasma, which activates osmoreceptors to stimulate ADH release. So this is the end of part 1. Join us in part 2 and part 3, where we'll look more in depth at some of the endocrine organs. At this point, what I'd recommend you try and do is draw out that diagram we started with a little while back in respect of what does the hypothalamus release, what does the anterior and posterior pituitary release, and then where does it act and what does it do when it acts in that location. Because understanding that simple flowchart can actually mean you've pretty much cracked a large portion of the endocrine system. That's everything for this video. Join us next time and we'll take a look at some of those more specific endocrine organs. Thank you for listening.